Hey guys, thanks for watching. Welcome back to our channel. This video is going to be a little bit different than the other ones that we filmed, but I figured that it might be able to help someone that's out there maybe going through the same thing. I know when I experienced it, the first place that I probably turned to besides Google was YouTube to see other people's experiences, to see how they dealt with it, how they coped. So I'm hoping that my video might be able to help someone going through a certain situation too. So I experienced a ruptured ectopic pregnancy on March 11th, which was a Sunday, about 5:40 in the morning. I woke up my husband and I told him that I was having severe abdominal pain and I needed to get to the ER ASAP. You know, I changed, brushed my teeth, freshened up a little bit, and we were out. I knew at that point that waiting for an ambulance to get to my house wasn't an option. We lived probably about 10 minutes away from an ER, so I knew that if my husband drove pretty fast, I would probably get there faster than an ambulance could get to me. So we get to the ER, my husband finds a wheelchair. He wheels me in, he talks to the lady at the registration window, and she tells us to have a seat. At that point, my clothes were already damp. I felt like I was going in and out of consciousness. I felt like I was seeing black, and I was a little afraid. I didn't know what was going on. I told him to go back up to the lady and tell her that I needed to be seen ASAP. He goes up, he tells her what I'm feeling. She told us to have a seat, that I would be taken back shortly. So a male nurse comes and gets us. He wheels us to a small triage area, tries to take my blood pressure, and is unable to get a reading. So he takes us further back into the ER where they let me lay down. At this point, the pain was so intense. A couple minutes later, a doctor comes in and he asked me what's going on. You know, he had read a little bit of the information that we provided, but he wanted to know if I had any more information to give him. So I told him that I was 9 weeks pregnant, that I was having severe abdominal pain, and I wasn't sure what was going on. So he ordered a bedside ultrasound. The lady came and did it, and during that time I'm asking her, does everything look okay? You know, I just wanted to be reassured that everything was fine. She told me that she couldn't tell me anything, and this is something that I knew because I've had an ultrasound in the past, and I know that, you know, that we have to wait until a doctor comes to give us the information. So the doctor comes back and they wheel me into another room that's a little bit larger, still in the ER, and when I get there, there's tons of nurses. Right away, we're signing consent to have a blood transfusion. They're putting in IVs, multiple IVs in me to give me fluid. And he ordered another ultrasound. At this point, I can hear him and the other nurse is talking. You heard him say that there was free fluid in my abdomen. So a little while later, he comes back and he tells me that I'm in really, really bad shape, that I'm bleeding internally, and that I need emergency surgery ASAP. He said that he had already contacted an OBGYN doctor and that he would be down shortly to discuss everything with me. So during that whole time I'm waiting for the doctor to come, I think he was delivering a baby at that time. So it did take a little bit. You know, they're still checking on me. They're asking me how I'm doing. They're trying to reassure me that everything's going to be okay. At this point, I started to get emotional. I still really didn't understand fully what was going on. But I remember telling the doctor, after he told me that I'm in bad shape and that I could die, that I needed to live, that I had an 11-year-old son, or I had a baby to go home to. And the nurses would ask me, how old is your baby? And I remember telling them he's 11, and they would like laugh like, oh, that's a big baby. So we waited for the doctor to come down. I gave consent. They wheeled me back to the operating room, and I remember waking up a couple hours later and just wondering like how everything went. You know, where's my family? Why am I alone? I thought that I would wake up to them, and the nurse just said that, you know, I'd been there for a couple hours and that they were gonna let my family see me in a bit. Time passes. It felt like it was hours. I think I went into the operating room at maybe 8 or 8:30, and by the time I was being wheeled up to recovery, or after recovery I should say, to my room, it was already I think 4 or 4:30. So I'm being wheeled into my room, and I remember a male nurse being really confused, like, why is she here? We're not ready for her. Unsure why I was there. And they wheeled me into the room. I remember there was another lady in there with her family, and they were super obnoxious, super loud. But at this point, I was still kind of feeling loopy from the anesthesia. So I was just kind of like, I just want to see my family. I just want to relax. My family comes in, and they just looked really worried. My sisters were crying. My dad looked, you know, visibly upset. He looked nervous. My mom is always the strong one, but I could tell that she was worried. My husband's usually pretty strong too, but I could sense a panic on their face. So I remember a nurse just coming in and telling me that I needed to breathe and I needed to relax, that my heart rate was really high and elevated. So a little while later, she comes back in and she tells me, you know, there's going to be a lot of doctors coming in here right now, but don't worry. Sure enough, I remember a bunch of doctors coming in, and these are doctors that are trained for certain situations. If I were to go into cardiac arrest or have a stroke, they were trained to handle certain situations. And I don't think I really realized this at the time, but of course I Google everything after. And I was trying to figure out, like, why did they call for all these doctors? You know, it makes me realize now I was in really bad shape. Time passed a little bit, you know, my heart rate stayed elevated, and they told me that I was going to be going down again, that I still had internal bleeding, they thought, and that I needed to go in for a second surgery number 2. So I remember them taking me down and giving consent again. They said it would be exploratory again. They didn't know what was going on, but that they had reason to believe that I was probably still bleeding. So I meet with the anesthesiologist. I'm waiting. They come in and tell me that I need to have another test done. I'm kind of unsure what the test was. I can't remember, but I remember them wheeling me out and just being in so much pain, having to get from one hospital bed to another while they did the test, you know, just coming out of surgery a couple hours before, my abdomen just hurting. So I had an exploratory laparotomy where they opened my abdomen up from side to side. And this is the first surgery, mind you. They removed my right fallopian tube and cleaned me out, stitched me up. After that test, they took me back to the surgery area, the operating area, and I was just waiting. And I think during this time, my mom met with the doctor, the surgeon, and told him that she wasn't comfortable with it. You know, she didn't understand why I needed to go into surgery again. What else could they do for me? You know, my heart rate was super elevated. Basically, I think she was concerned that I was not going to make it during the surgery. So they decide to take me to the ICU. At that point, I was able to see my family again. My husband, my sisters, all my aunts and uncles, majority of them came. And I'm super, super thankful for their support. It makes me feel so blessed that we have such a close-knit family and that I can really rely on them, and that my mom's siblings were there for her during that time. My brother-in-laws were there. So we were just kind of waiting. You know, they had given me something to help with the anxiety and hope that that was the reason that my heart rate was so elevated. I remember another doctor coming in, he was a radiologist, and he said that, you know, my heart rate was still elevated and that they had reason to believe that I was still bleeding internally, and that there was a procedure that they could do, an artery embolization. It would go in and stop all blood flow to my uterus. And they had another female nurse come in and kind of explain what it was. She said that she experienced this before. I remember telling them that I was afraid of not making it through this procedure, that I had just gone through surgery, and that I didn't know if I was strong enough. I just wanted to know that I could survive something again. And they told me that their main concern was that they wanted me to know that it could possibly decrease my chance of being able to become pregnant in the future, And at that point, I think I had already kind of made up my mind. You know, when I delivered my son 11 years ago, I had a really bad seizure and I could have lost my life then. At this point, I was just feeling like, you know, maybe pregnancy and my body just don't go well together. Maybe it's just supposed to be my son. Maybe I'm not meant to be a mother again to another child. There were so many thoughts going through my mind, but I knew that right now my main focus was getting home to my son, was to live. Nothing else mattered at that point. And they just told me that the first 8 hours after the procedure was going to be really, really painful. But after the first 8 hours, you know, that everything would be a little bit better and that it was going to help my heart rate and that it was going to stop the bleeding and that basically I was going to recover and be okay. So I had made up my mind. He told me that he was going to give me about an hour to decide what I wanted to do. Then they would prep me, and within 2 hours I would probably be going and having this procedure done. So my dad was there, everyone else was at work, including my husband, and my dad just kept saying, you know, we need to wait till her mom gets here. She'll be here in a little bit. She's on her way from work. We can't make a decision. We can't do anything until her mom gets here. And I remember being confused, like, I'm an adult, you know, I'm making this decision. It's what needs to be done. It's what's going to save me. Like, why is this even a question, you know? But I understand, you know, that there's concerns as a parent. You just want to make sure that your child is strong enough to even handle something like this. So my mom gets there and I remember her talking to the doctor, the radiologist, I believe, outside. And I think she just wanted to know if there was any other options. You know, she wanted to make sure that this was the last resort. Again, my heart rate was still elevated. She wanted to make sure that I was strong enough to deal with something like this. So they agreed to give me another blood transfusion, I believe, and medication to try to see if maybe it was just anxiety that was raising my, you know, my heart rate. Anyways, so it was touch and go for a couple days. I was in the ICU for, I believe, 6 days. And during that time, it was just kind of like I said, very touch and go. But with a lot of prayer, I believe, came recovery. And I was transferred upstairs to another room, released from ICU. I remember just being anxious, being in a lot of pain, and I just wanted to go home at that point. So they were, you know, constantly poking me, drawing my blood about 6, 7, 8 times a day. They were doing it every, I think, 3 hours for a while. Then they changed it to every 6 and then every 8, then every 12. And they wanted to just make sure that I was, you know, recovering, that my hemoglobin was coming back up, that I was doing okay. I had lost, I believe, almost 2 liters of blood into my abdomen. So they wanted to make sure that, you know, I was stable to go home. And after, I believe, 6 or 7 days, I was able to go home. And I just think that super, super thankful that I'm here. I realize that life is so precious and that it can be changed in an instant. You know, the words that the doctor told me that I could die, you know, that they were doing everything that they could for me, still haunt me. I mean, they replay in my mind quite often. Be careful. You gotta find your practice clothes. But I know that everything happens for a reason, and I believe that it made me stronger. I think those words that he told me pushed me to live, pushed me to fight through it so that I can come home to my son. And I'm super thankful that I had my family support, my husband, to help me through this. I'm still recovering, you know, emotionally. It's been up and down, a very, very traumatic experience, and something that's probably going to be one of the hardest things that I've ever gone through in my life. But I just know that there's other women that are probably going through certain situations, and I just want you to know that you can reach out to me. Like I said before, YouTube was probably the first place that one of the first places that I looked to try to see what others went through. So if you're dealing with this and you need someone to talk to, please, you know, leave a comment down below. I can provide you my email address and we can talk. You know, I can explain how it was for me. We can share stories. And just know that you're not alone, that there's other people that have gone through this. And what doesn't kill you makes you stronger. We can't question why certain things happen, but we just have to trust that this was in his plan. And I hope you guys enjoyed this video. Like I said before, I know it's super different than what we normally do on this channel. But I hope that it does help someone. So please, if you're not already subscribed, please be sure to like, comment, and subscribe. And we'll see you on the next one. Bye.